Hi, my name is Diana Berrent, and I am the founder of Survivor Corps. And welcome to the Survivor Corps webinar series. We know that you can't always get to the experts, so Survivor Corps is always here bringing the experts to you. Today we have a great guest. We have Dr. Lucy McBride. You might know her from her amazing newsletters that are quite the sensation, and she'll tell you how to sign up for them if you're not already signed up, but I highly recommend it. Dr. McBride is an incredible resume right here, which I'm not going to go through the whole thing because we'll be here all day, but suffice it to say that she went to Princeton undergrad, Harvard Medical School, was a Fulbright scholar at Cambridge, did her internship and residency at Johns Hopkins, and spent many years on the emergency medicine faculty at Johns Hopkins before becoming an internist in Washington, D.C. Her special interests are hypertension, heart disease, diabetes, and women's health. But what makes Dr. McBride so interesting and so relevant to our conversation today is her focus on addressing mental and physical health in tandem to optimize health and well-being. So on that note, Dr. McBride.
Diana, thanks so much for having me. I'm really, really happy to be here and just so impressed with what you have put together, you and your organization. It's such a needed service for people. As you know, there's so much information coming at us all the time, like water out of a fire hydrant. And people are really starved for real-time, fact-based, practical information on how to get through the pandemic mentally and physically. So my job is and historically has been to see patients as a general practitioner. I'm an internal medicine doctor. I see patients with hypertension, diabetes, high cholesterol. I manage people's heart disease, pick up breast masses. I do general internal medicine. My interest, as you said in that nice introduction, is the human experience of illness and how we experience illness, but also how we experience our day-to-day existence in the world. Healthcare to me isn't just about checking with your doctor once a year. It's about how we live every day. And under that umbrella is my interest in the very real thoughts, feelings, and behaviors that inform our day-to-day existence. So as you know, we all have mental health. We all have this organ at the top of the whole pile here. You cannot opt out of having mental health like you can opt out of a feature on your iPhone, for example. You have mental health just like you have cardiovascular health, you have breast health, you have other organ systems that need caring for. So my thesis when I'm working with patients and now a larger audience through my newsletter is that mental health matters. Mental health matters in terms of how we feel every single day. It also directly informs our physical health. Our mental health and our physical health talk to each other, and our mental health informs our physical health and informs our medical outcomes. So for example, today I saw a patient who came into my office with very high blood pressure. She has a known history of high blood pressure. And my job isn't simply to ratchet up her blood pressure medicine, but rather to understand the mechanism by which her blood pressure is surging, which may sound familiar to some of you. She's under enormous stress, has a very important job, responsible job. She's in her mid-50s, and as a result of the stress of the pandemic, helping her kids get through, virtual school, she's been drinking more alcohol under a lot of stress, not sleeping well, and as a result, her blood pressure is surging. So my job is to help untangle these issues and to help decide how to better manage stress, to redirect her thoughts and feelings towards more healthy habits, and to provide a safe, non-judgmental space in my office to understand how her mental health and physical health connect. So I've been doing this for 20 years, seeing patients. COVID hits, and all of a sudden there's a spotlight shined on this very real intersection between mental health and physical health. So I have felt it my obligation and duty, and really my pleasure, to help inform a wider audience about these very real issues, how our thoughts and our feelings inform our bodily health, and how anxiety, loss, grief, trauma, mood issues, and uncertainty, feelings of vulnerability, how those things manifest in our bodies and minds, and how they inform our very real health outcomes, as I've said. So the coronavirus pandemic has provided this opportunity for me to educate a wider group of people about those very real issues. So, one of the things I talk about with people every day in my office is the stress of the pandemic. Whether or not you've had COVID-19, and I know many people in this audience have had COVID-19, you are no doubt experiencing some sort of trauma, loss, grief. Our lives have been upended. Our routines have been thrown out the window. Our day-to-day existences have changed on a dime. And so it's normal to have some sense of low-grade anxiety. As you know, Diana, anxiety is part of the human condition. We're wired for survival as human beings. So to have a sense of anxiety when we're faced with a threat like coronavirus is normal. So the first thing I do is I recognize with patients, having anxiety and fear is normal. It's part of being human. The question is, how do you deal with it? How do you address it? And how do you cope with those feelings that then can become physical? If you've had COVID-19, you no doubt have experienced fear, in addition to the very real physical symptoms of the virus itself. So one of the things I help people do is put together sort of a coping kit or a survival kit to get through the pandemic. And some of the things I'm talking to people about in particular are this. Number one, prevent yourself from getting coronavirus and prevent yourself from transmitting it to other people. Now, if you've already had coronavirus, you can get it twice. It's very, very unlikely. And we don't know yet if having coronavirus and having the very real immune response that you should have after having coronavirus allows you to be sterilized from coronavirus. In other words, we don't know if having had coronavirus means you can't transmit it to other people. We know that you don't have the virus in your system for after 10 days, but we don't know if you can carry it you can catch it again and then carry it and transmit it to other people. So one thing is important for people to know in terms of protecting themselves is protecting themselves from getting reinfected, because that is possible. Secondly, to protect other people in their midst from getting coronavirus. As you know, there's such a huge ripple effect when you get coronavirus and then when your loved ones are exposed. And we can talk about isolation versus quarantine in a minute. The other thing
you've gone through a pretty personal situation that you've been very bravely sharing with the world. And so maybe we can compare some notes on how we each handled it. When COVID comes into your home, as it inevitably will strike somebody, how do you deal with that?
Right. So just like many of you, we're all experiencing pandemic fatigue. We're exhausted from having to manage the stress of our lives being turned upside down and the vigilance it requires to keep coronavirus at bay from ourselves and other people. So my husband, who is extremely diligent, has been practicing really, really aggressive risk mitigation and working from home as an attorney for 9 months. A week and a half ago, or 2 weeks ago now, he was on his bike doing errands in the neighborhood, going to the Giant, the CVS, and then ended up stopping by a neighbor's house to pick something up, who said, "Hey, it's your birthday, come in for a quick beer." They were at the island in our friend's kitchen, distanced, and had a beer for 20 minutes. And next day, our friend announced that he had developed coronavirus. My husband ended up getting it. He had to isolate within our house for 10 days. The rest of us had to quarantine. Thank the Lord, he did okay. He's doing much, much better. All of us are fine. None of us have gotten infected from him, and we did our, requisite quarantining. But, we are the lucky ones. Many of you have been a lot sicker than that. Some of us have been hospitalized. And of course, the death toll is enormous. This week we're losing 3,000 people a day from coronavirus. So even if you were lucky enough to not get a severe illness, we know that the effects of coronavirus on other people who are more vulnerable can be devastating, and the effects on our, families is devastating. The other thing we should talk about, Diana, at some point is another reason to get vaccinated if you haven't had coronavirus already, is not only to prevent, a potentially 3-day flu or hospitalization, There's a range of symptoms, but also to prevent the long hauler symptoms. As so many people are experiencing the very real long-term side effects of COVID-19 well after the virus has cleared the body. So a lot of my patients are experiencing fatigue, brain fog, body aches, joint pains, fevers, well after the virus is gone. And this is real. It's important for people to understand this is not made up. This is not people malingering. This is a very real phenomenon. And all you need to do is look at the studies. The studies are real and they're coming out more and more, showing that a large number of people, perhaps up to 50% of people with moderate COVID, develop long hauler symptoms or a long tail of COVID-19.
You're preaching to the choir with this group, most of whom are really suffering the worst of the damage, the vascular and inflammatory damage that's left over by COVID.
That's right.
And we're starting to see, my son had a fairly average case of COVID. He's now 12, he was 11 last winter. I never would have called him a long hauler kid. And then 3 weeks ago, he lost one of his front adult teeth spontaneously with no blood loss from presumed vascular damage. I posted it on Survivor Corps and the answers started flooding in of all of these people who have experienced the same. And so when you say that it's 50%, I think that it's going to be a while before we know just how many people are affected by this, because it could be a real lag time.
Absolutely. And the first thing that's important to realize is you're not alone. This is happening. This is real. And if you're confronted with healthcare providers who aren't taking it seriously or believing you, then you need to find another doctor or another healthcare provider until that provider is educated on the very real facts of this virus, because this is a real phenomenon. We also know that mental health challenges can flare. If you had underlying depression or anxiety, it tends to flare post COVID-19, which makes intuitive sense to those of us who deal with mental health issues in their offices every day. But I think all of us, as I said earlier, who are sick or well, are experiencing anxiety and depression. But people who have gone through the disease itself, the terror of the disease, and then also the stigma around it. I mean, let's face it, there's a big stigma around having COVID-19. I think there are people in this country who are flouting the rules, who are, denying that masks work, that distancing works, that vaccines make a difference, which we all know on this call. We know that masks work. We know that the vaccine is 95% effective. It's going to be approved by the FDA hopefully today. We know that distancing works. So there are people who don't believe the science and trust facts. But there are also people who are a little more even dangerous, if you will, who just have this belief that people who are infected with COVID, are bad people or they did something wrong. When let's face it, it is human nature to need to connect. We are wired for survival, which is why our adrenaline and cortisol stress hormones are surging through our veins. We're also wired for connection. So it's natural to want to see other people, like my husband did in the kitchen of his friend. He is really remorseful about what happened and, feels terrible. But let's face it, all of us are trying our best. We're doing the best we can. And if we catch coronavirus from some risk that we underestimated, I don't think there's any role for shaming people right now, right? We need compassion, empathy, and understanding. And, we're all human. We're in this together.
100%. I say that all the time. There is no us and them in this story. We are all in this together because it doesn't matter who believes in what, the virus believes in spreading. So
that's right.
I'm curious, when you're talking about this anxiety and depression, I've also been led to understand that there is a neurological impact from the virus. How do you tease apart the sort of medical neurochemistry aspect from the fact that it's 2020 and we're 10 months into a pandemic and lockdown and we're all going crazy?
Well, it's sort of akin to what we do in the world of mental health anyway. There's no blood test for anxiety. There's no blood test for depression. There's no blood test for trauma and grief. Making a diagnosis of anxiety, depression, grief, trauma, PTSD, OCD, those are clinical diagnoses. that are founded and rooted in the relationship with your doctor. And so the way I make a diagnosis of those kinds of issues is by talking with my patient. So if there's a clinical history of COVID-19 and a clear difference in, for example, mood post-COVID that warrants attention with medication, therapy, a combination therein, and more importantly than the treatment is the amount of disability it's causing. If mood issues have become difficult to manage, they're affecting people's quality of life and are affecting their health physically, that's a clear diagnosis of depression. Whether or not COVID caused it or the experience caused it, we may not ever know, but it doesn't really matter, Diana, because the treatment is pretty much the same. I mean, we very well know how to treat anxiety, depression, trauma. It's just that in this country, unfortunately, there's still a lot of gaps in people's understanding about when is it appropriate to get help. And then on the physician side, when is depression not just situational? When is it a capital D depression? When is anxiety not just, oh my gosh, my kids are struggling to learn on Zoom school? And when is it a capital A anxiety, where anxiety is informing our physical health and causing us to feel sick?
So I'm very curious. So obviously, what are the tools that one can use to control it? And when do you know that you need to seek help for these things? But sort of my first reaction when I hear this is a lot of our members are going to their doctors because they're experiencing ongoing GI issues or heart palpitations or whatever it is that their ailment is. And they are being diagnosed with anxiety and depression and being shown the door. And while, yes, they probably are anxious and they are depressed, because who wouldn't be right now? To some extent, I feel like it's being used as a sort of cop-out when folks really need to see a cardiologist or, a gastroenterologist, or there's actually something physical going on as well that needs to be taken care of. And I think a lot of these patients are feeling gaslit when everything is being swept away in the anxiety pile.
Well, first of all, what you said a minute ago is really, really important. Being shown the door because you have anxiety and depression, first and foremost, is inappropriate, right? Anxiety is a disease like, hypertension, right? So it certainly can be informed by experiences. It can be informed by, poor, health habits. But anxiety is not something that any physician should say, oh, you have anxiety, therefore you don't need to see me, right? Anxiety is something we need to address. Now, I mean, this leads me, or could lead me, into a long conversation about what's wrong with our healthcare system in the United States, and how my hope and dream is that my kids, your kids, our kids live in a world where mental health and physical health are treated in tandem and treated as co-equal, and that the doctor listens to your blood pressure and heart rate, and also asks you about how you're sleeping, how you're eating, what's your relationship to alcohol, how are you managing work stress. So well before the pandemic, well before COVID-19, there's a misunderstanding about mental health and its relevance. But you're right, people who have very real physical symptoms from coronavirus need to be taken seriously and need to see the appropriate specialists if, for example, they have heart palpitations or GI issues. It's not to say that we have treatments for these things per se right now, but they do need to be addressed in the appropriate place. And I would just encourage you to keep looking for the right doctor to help you. I mean, there are a lot of good doctors out there who know mental health and know physical health and know where to draw the line. But unfortunately, it takes some searching.
So a lot of our members, I mean, I'm very lucky. I live outside of New York City and have access to, all of the greatest hospitals and doctors in the world. You're in Washington, D.C., the capital. But, we have a lot of members who are in much more rural areas, small towns, where there's not a plethora of doctors to choose from. And so what is your guidance for people who are, they're going to the doctor because they feel like they're being gaslit by their families, by their doctors? Like, what do you mean you're still sick? I had COVID and it only lasted 5 days for me. I don't know what's wrong with you.
First thing first is take it from me that I'm seeing this every day. And that these patients are not people who want to be in my office, want to be calling me. Secondly, look at the medical literature. I mean, I can send you around via email, Diana, later, the studies that are showing the very real, long hauler effect. I mean, it's real.
Some of the studies are coming out of Survivor Corps, actually, and I do recommend that everybody go to the Survivor Corps website. And we do have many members who print out that symptom list, highlight all of their symptoms, and bring it with them to their doctor, and as a way of educating their doctors. And we have a lot of doctors in the group too who are here to become better clinicians, which I have tremendous admiration for.
And one of my favorite ways of getting information during the pandemic has been through TWIV, This Week in Virology, with Dan Griffin, who did mention Survivor Corps on one of his episodes. Dan Griffin is the clinical advisor for This Week in Virology. And, he is agendaless, right? He is just trying to help people, hopefully like I am, understand the facts and science and get people through the pandemic safely. And he does a wonderful job of explaining the science and the data on the long hauler effect, which is very, very real. So I encourage you to listen to Dan Griffin on This Week in Virology. But there are some things you can do if you don't have access to a doctor who can really pay attention to your symptoms post-COVID. And moreover, because there are not any known great treatments for these phenomena, though, let me say this, for people who have lost their sense of taste and smell, there is some good evidence that a short course of oral steroids can help that quite a bit. And Dan Griffin is someone who's talked about that on his podcast. We treat people supportively, meaning we treat the symptoms. We can't treat post-viral COVID symptoms like en masse right now because we don't have any particular treatment for that right now. But we do treat people, like, for example, people who have persistent muscle weakness and muscle aches. You can use Tylenol, you can use Advil, you can use ibuprofen, as long as those are safe for your unique body. And you can use graduated physical therapy. So a gradual increase in your movement over time. Exercise is showing to be very effective, not unlike my patients with chronic fatigue syndrome, who oftentimes also have post-viral symptoms. We're learning a lot about these patients who historically have been called, fakers or malingerers. And we're learning that a lot of these people have had viral syndromes, and COVID is going to help shed a lot of light on those patients as well. For heart palpitations, there are medications like beta blockers. There's hydration, of course. And there's also psychotherapy, not because you're crazy, but because you're human, right? So, oh dear, I recommend psychotherapy. Excuse me. Let me turn that off.
You're a doctor, you're allowed.
Real-time doctor's office. I recommend psychotherapy to people, again, commonly, I have always, but particularly right now when people are, suffering from the long hauler effects. But anyone who's experiencing vulnerability, loss, a feeling of uncertainty, worry, sleeplessness, this is a good time to reach out to get extra help. There's never a bad time to do that.
Where do you go to find this kind of help? I mean, I imagine it's all through telemedicine these days.
That's right.
Where do you go find these services, and how do you find somebody who you're going to connect with over a screen, in the middle of this? How does that work?
Right. So the first place I would go is your doctor. If you have a doctor and your doctor has good resources. I mean, I recommend therapists to people all the time. But if you don't have a doctor or someone to call, there are some good online resources. First of all, AA is online, fully right now, which is wonderful for people who are struggling with their relationship with alcohol, which is many, many people. And by the way, you don't have to be someone who, is a severe alcoholic to benefit from AA. Talkspace is an online therapy program that is more affordable. And you can look at online at, the national, it's, SAMHSA, SAMSHA, the Substance Abuse and Mental Health Services Administration is a federal government agency that has resources for people all over the country for mental health services. So those are good places to start. I mean, the other thing you can do is learn how to meditate. Get a meditation app like Headspace, 10% happier.
Headspace fan.
Headspace, 10% happier, Calm, Insight Timer. take a break from screens. We all need a break from Twitter, Instagram, Facebook, and the national news. And, we're going to get the news one way or another. So you might as well take a vacation from it. I'm going to take a vacation from it this weekend, and I'm really excited about it. The other thing
you're a stronger woman than I am.
Yeah, it may not last, but we'll see. So it's like, do as I say, not as I do, as I go to bed with Twitter, like right up in my face. Try to get off screens at least an hour before bedtime. Prioritize sleep. Try to get 7 or 8 hours of sleep. These are just basic biological needs. Sleep, movement, getting outside, even if it's 30 degrees and freezing cold outside, put on some good clothes, get a good walk around the block, and get outside. I mean, these are simple ways to ease your anxiety and improve mental health.
That's great. Those are all really, really important. I'm a huge fan of meditation. And for anyone who wants to start out and finds it intimidating or a little kooky, I highly recommend Headspace. They give you very clear classes and great imagery to really understand it. I'm a huge fan. I've given it out as memberships as gifts many times. So Dr. McBride, you've been very public about your husband's story, and can you just walk us through how you did it? How did you keep everyone else in your family from getting COVID, and what day did you get you and your kids tested into it? Did you get yourself tested twice? Can you just sort of walk us through the mechanics?
The practicality. So the answer to the question of how did we not get it is really, I don't know. I mean, we live in the same house. My husband and I sleep in the same room. I don't know how I didn't get it.
Right, because presumably you're more contagious in the 2 days leading up.
That's right. You're contagious you begin to be contagious 48 hours before you exhibit symptoms. And we had been together, all of us as a family. So some of it is luck. I have been taking the vitamins that I do believe help potentially with antiviral effects. Now, there's a lot of pseudoscience going on around town, but I will tell you that there's compelling data in my mind that vitamin D and zinc and vitamin C can help protect you against COVID-19. They are not a panacea. It's not something I would count on. But I've been taking vitamin D 1,000 international units daily, zinc 25 milligrams daily, and vitamin C 500 milligrams daily. Now, ideally, you would have your blood levels checked with your doctor before starting any of those supplements, particularly the D and the zinc. But it's generally safe for people to take 1,000 of D and 25 of zinc. I do not, however, believe that that's why we didn't get coronavirus. I think, and I don't have antibodies either. I've checked myself for antibodies before because I've been seeing patients since March. So it's not that I'm immune. I think it's just luck. I think my husband, for some reason, is not a super spreader. And, the minute he had symptoms, we isolated him in the basement, poor guy. Not really. I mean, it was a little bit of retribution. No, he was in the basement.
Please, I have to tell you, I was in isolation for 18 days because at the time we didn't know how long you were contagious for. So I waited until I had a negative follow-up test. I was probably the only person in America who got a follow-up negative test in March when they were so, sparse. But I have to say those 18 days, I was pretty sick, but it was kind of magical. I didn't have to cook any meals. There was no homework it was a vacation in some way. Other than the being sick part, nothing wrong with some time in isolation. You can really enjoy it.
Yeah. And in all seriousness, it was hard for him. He felt so bad about it, but it was logistically challenging. We are very, very fortunate that we have the space in our home that we could isolate from him. So we isolated him, sealed him off. When we delivered him food, we would wear an N95 mask, a face shield, and I would knock on the door, put the food on the ground, and run for the hills. And first of all, secondly, in the first couple of days, the kids and I also tried to separate from each other because we didn't know if, for example, I was going to get infected, the other ones weren't. And so we masked up in the house and tried to separate from one another so we didn't inadvertently infect each other before we knew that we were clear. The first date that you could potentially get tested after an exposure is 3 days. Getting tested sooner than 3 days after an exposure is really a waste of time because any test will be negative because that's the incubation period. The incubation period is the time between exposure and infection. And even the PCR test, the most accurate gold standard test, will be negative in that incubation period. So
when you say you went to get tested, where you talk, or did you take the antigen test or the PCR test?
No, the PCR test. The antigen tests are not useful in asymptomatic people. The antigen test is the one we got to diagnose my husband because he had symptoms. It's really important to make this point. Antigen tests are contagiousness tests. They are tests of contagiousness. So they are not going to be positive usually in people who are asymptomatic. So it's a waste of time to get an antigen test if you're looking to see if you have the virus post-exposure. Down the road, I don't know if anybody here has been following Michael Mina and his work out of the School of Public Health at Harvard. So I know his work well. Someday we'll have the lick-a-stick rapid antigen test we can do every day, and that might help us move forward. But for now, the antigen test really should be used for people who are symptomatic. So we got PCR tests, and I actually had us wait 5 days. I didn't want to waste our time doing it 3 days and learn we're negative because we had to quarantine for 10 days anyway. So we got tested at 5.
Can you go through those days again? Because there's been a lot of confusion and a lot of revisions recently on what the quarantine days are. Can we just lay it out of, if this happens, it's this many days. If that happens, it's that many days. We need rules to follow. And
sure.
I think that would give everybody some ease of mind and relieve some of that anxiety if we just had some clearer guidance.
Yep. So the CDC revised their guidelines last week while I was in quarantine. Right now, the latest recommendation from the CDC, and by the way, it could differ in your state, in your Department of Health. The recommendation is that after an exposure to coronavirus, not you having it yourself, you've been exposed to someone with presumed or known coronavirus. So that counts as someone who's traveled, someone who's been in a household with a family member with coronavirus. Any exposure warrants a quarantine. The quarantine.
What if everyone was masked during that exposure? Does that count as exposure?
So let's talk about. We can do that first. Then a contact is strictly defined as a contact with someone with coronavirus who has contact with coronavirus for more than 15 minutes over a 24-hour period closer than 6 feet. Now, there are so many shades of gray, right? My husband is a contact of the person, his friend who had coronavirus. He was there for 20 minutes indoors without a mask further than 6 feet. So what I'm telling patients is, and I'm guiding people every single day because there's so many different scenarios, right? It's rare that you're standing 6.0 feet from someone for 15 minutes or 14 minutes exactly, and then that qualifies you as a contact or not. You need to talk to your doctor about what qualifies as a contact. When in doubt, assume you have had contact. In fact, the CDC has advised, and I totally agree with this right now, given the case rates we're seeing, assume that everybody outside your house in your midst has coronavirus, and assume that you can get it from anyone in your midst, and exercise extreme caution by wearing your mask always, distancing from 6 feet by 6 feet, being outside when possible, avoiding crowded spaces, and practicing hand washing. So you should, like they said after the Thanksgiving travel, if you have traveled on an airplane and you've traveled for Thanksgiving and traveled between states, assume that you have been in contact with coronavirus, right? And so that means you need to quarantine. Quarantine right now, the best recommendation I have, and this is CDC guidance, the best and safest thing to do is quarantine for 14 days after an exposure. And you don't need a test at 14 days, but you can get a test any time along that point. But again, don't do it sooner than 3 days after the exposure. But CDC has given 2 options to be released from quarantine sooner than 14 days, even though 14 days is still optimal. The first is to quarantine for 10 days. And if after 10 days you have no symptoms, for the remainder of the 2 weeks, monitor your temperature, monitor for symptoms, and you're done after 10 days. The other is 7-day quarantine with a negative PCR test. They say negative test, but I would not release myself from quarantine after 7 days without a PCR test in or around that 7-day mark.
So you still have to then wait for the PCR results to come in, which negates it actually being 7 days, most likely.
Well, CDC actually says that you can get a PCR test 48 hours before the 7 days is up if you stay in quarantine for 7 days to account for resulting delays. So you can technically get a PCR test 5 days after an exposure when you're in quarantine, allow it to come back negative on day 6 or 7, and be released on day 7 if it's negative. So that is, some of this is motivated by the desire for people to get back into workplaces and for better compliance, because it's very hard, as we know, to comply with a 2-week quarantine. So, it's better to err on the side of caution. And if you can get a test, if we could get PCR testing on every American every single day, we would be done with the pandemic. So short of getting it every day, at least get one, at 7 days after an exposure, then consider whether you can leave quarantine with the help of your doctor. And if you can't get a test, wait till 10 days and monitor closely your symptoms. Best case is 14 days. So as you're planning holiday travel, my best advice is this: don't travel anywhere, stay home. But again, no shame if you need to travel to see your mother who you haven't seen in a year and this may be her last Christmas, or for whatever reason. We need to not judge each other right now. I am trying to help people with the facts and the guidance, but also understand that we need to be realistic. People will travel. If you're going to travel this Christmas or holiday season, you need to quarantine at a minimum of 7 days before you leave. Quarantining meaning you can't go to work, you can't go to school, you really shouldn't leave your house except for absolute essentials. Really at all. And then you should get a test at 7 days or 6 days, and then quarantine for the full 7, and then travel, being very careful with masks, distancing, avoiding indoor crowded spaces, try to drive and not fly. And then on the other side, quarantine another 7 days and get a test at 7 days.
So once you've done that for 7 days before you leave, 7 days once you arrive, 7 days then before you travel again to return home, and 7 days upon return, you're already up to a month of quarantine for that one holiday meal.
Which is why logistically and medically it's recommended not to travel, and rather, because we all need to mark these holidays, we're all exhausted from missing graduations, birthdays, bat mitzvahs, and all the different ceremonies that are sprinkled through our life and that give us meaning. We need to figure out a way to safely celebrate. And for us in my family, I've got 3 teenagers. We have invested in Amazon heated blankets and a fire pit, and we are going to have an outdoor Christmas. My parents are local, and so they will walk over and we will sit more than 6 feet apart from them, masked, bundled up, and just have a moment, because it's important for our mental health to have some sort of semblance of a holiday. If you can do outside and distance from people 6 feet, wear a mask, you really shouldn't get coronavirus. The problem is when people go inside and they're passing dishes and the windows are closed and masks come off. And then when alcohol is flowing, let's face it, people are a little more liberal with their behaviors.
Right. I will say I got COVID at a meeting on March 9th. It was before masks were being used. It was one step away from a super spreader event. 2 of the people at the meeting had been at a super spreader event in New York City. And it was not a social meeting. There was no food. I wasn't sitting close to anybody. Everyone was quite distanced in the room. Every single person in the room was infected, and one died 3 weeks later. So I am fascinated by the fact that monoclonal antibodies are now available, but it's a very complicated system of getting them, because you need to get them within 3 days of diagnosis, and it has to be done in a hospital setting. But if you're not seeing a doctor when you get diagnosed with COVID, I understand that your husband got them. How does the average person get them now that they are available?
So my husband was in a trial, even though they've been FDA approved on an emergency use authorization basis. There's still a trial. So there was a trial. It closed actually last week. We were joking that my husband closed the whole thing down. But so it was a trial doing placebo. So, 30% of people got placebo, 30% of people got dose X of monoclonal antibodies, and 30% of people got another different dose. So we have no idea if he got placebo or the real thing. We'll find out in a year.
They're still doing trials even after the EUA. I thought that
That's what I'm saying. Yeah, this one was a placebo-controlled trial. I know, because it was, yeah. So, but those are all closing now, and now it's so I've gotten a patient or two into GW because we're admitted we had them at GW registered to get the monoclonal antibodies within 3 days of their PCR and within 7 days of the illness onset. So, but you're right, it's not in great supply, and it's hard to get. So you can look online at your local hospital to see what kind of options they have. Certainly people who are going into the emergency room who are really sick are being prioritized as people who are going to get the monoclonal antibodies. I mean, it's very exciting because it's the first antiviral treatment for people who don't need hospitalization, who are in early COVID. But you're right. I mean, we need a lot more of these doses, and we need them now.
Yeah, and I mean, it also seems like a rather imprecise measure to say 3 days after your PCR test, rather than be it based on your viral load, let's say, a more precise. I mean, so who in the absence of those sorts of measures is the ideal candidate for getting monoclonal antibodies? Is it anybody, or is it only if you're above a certain age or have certain comorbidity?
So in the trials, they're giving it to all different ages. But right now, my understanding is that they're giving it to people who are over 65 with at least one underlying health condition, who are not sick enough to stay in the hospital or need oxygen. So remdesivir is the antiviral treatment that is being given, and we're not sure if it actually is that effective, but is being given to people who are hospitalized and need oxygen. For people who are not hospitalized but are at higher risk for poor outcomes, those are the people who are getting it.
Remdesivir and convalescent plasma in tandem, I know, is the Mount Sinai treatment of choice right now within 6 hours of admission, which I have to take a moment to make a plea for everyone on here. If you are up to it, if you have had COVID, if you have antibodies, please go donate your plasma. It is so important. 1 out of 3 patients in America right now for COVID, and 1 out of 3 patients hospitalized with COVID right now are receiving convalescent plasma, and that number would be higher if the supply was higher. So I just received my Gallon Club membership yesterday in the mail. I was very, very proud. Join the club with me, go donate. You can sign up at survivorcorps.com. Can we go back to some of the sort of anxiety and mental health issues? And, a lot of our kids are struggling, and, it's hard to be a parent in general. It's hard to be a parent in a pandemic. It's hard to be a parent of a child struggling in the middle of the pandemic when you're struggling also. What are ways that we can let them be with each other and socialize and, not be trapped in the house with us 24 hours a day, but have it still be safe?
Yeah, I mean, this is a really hard challenge. I mean, there's so many people I feel sorry for, like, people who can't, for example, isolate when they're sick, people who live in crowded living conditions, our Black and brown members of society are suffering at enormously disproportionate rates. And then, our children who, are so isolated and who really need school to, for their social and emotional health. You and I and many people on this call have lived long enough to know that this, will be over, and have developed, whether we did it consciously or subconsciously, coping skills. But a lot of kids don't have those coping skills to deal with this uncertainty. So yeah, we're seeing a lot of depression and anxiety and Zoom fatigue from kids. So many of them are being lost between the cracks because they're not getting the education they need. They're not getting stimulated like they need. And so it's really important as parents, and I'm trying to do this with my kids myself. As I said, I have 3 teenagers, to have an open dialogue about how you're feeling. Like, I care about my kids' grades, but I'll be fairly honest, I really care mostly that they get through this pandemic psychologically intact. So we have, I have this poster on my wall right here. It's the periodic table of emotions. And my kids tease me about it because I talk about, okay, so you've got anger, you've got frustration, you've got vulnerability. And basically it's like a rainbow of emotions to choose from, because let's face it, it's not like the primary colors red, yellow, and blue. It's not just we have anger, depression, anxiety. We have lots of different nuanced feelings. And one of the things that I'm trying to help my kids understand is that some of those feelings are uncomfortable and they're normal. And we sort of have to name them. And so, I show them this table every now and then. They're like, oh, mom. But it's really important in my mind for them to know that there are a lot of different feelings we have, and they're all valid, and they're all things that we should talk about. They don't necessarily want to talk about it with me, but it's something that they need to understand, that is real and that is relevant. And then what do we do to help them cope? I mean, I am, letting them take breaks from, like, my daughter, for example, is just having a really hard time with Zoom school. And so she's going to just take a day off school next week just to be outside and do some other things, because I think for her mental health, it's important for her to have just a day off. And then, I'm letting my kids, more in the summertime, but even now, like my 16-year-old son is going to have 2 friends over this weekend, again, around the fire pit with the Amazon, heated blankets. And he's such a rule follower that they'll probably be 10, 12, 15 feet apart from each other, but just to lay eyes on each other is important. Obviously, we need to be careful they don't come inside and, exchange, food, that kind of thing. And then, allowing them to be on screens. A lot of us as parents are distressed about the amount of screen time they're on, but remember that kids socialize online now. And if it weren't for online connection, it'd be a whole lot harder for them. So I'm relaxing my screen rules, knowing that even though it's unnatural to be on screens that much, I hear my son upstairs in his room, howling like a hyena with laughter, with his friends when he's not in school. So, giving ourselves a break as parents is important. Kids are extremely resilient. It's the grown-ups who are less so. We're anxious and we're trying to, parent and put food on the table and go to work. And we worry about them, and it's normal to, but I think they also are learning coping skills that we didn't learn at that age, perhaps, and that will it'll pay it forward. So I think we can, talk to them, give them some coping skills, ensure that they get some exercise, some outdoor time, some socializing time if it's safe, and then just not worry so much, because the kids are going to be okay for the most part.
Be all right. So how as a parent, how do you make the decision on whether or not to send your kid to school? What are the safety precautions that you're looking for? Because, this has all been left up to school district by school district to make their rules. My daughter is in a very large public high school. We get notifications every single day that there have been COVID cases in the school district. And some days they shut it down, some days they don't. It seems to be completely arbitrary. We have no idea what chemicals they're using to clean the school, despite having asked multiple times. There's so much uncertainty about how it's all working, and it's very difficult to assess as a parent. Like, is this a safe environment? What should we be looking for as parents in that decision of, do I send my kid in or do I keep them at home? Is hybrid the best? Not asking you your opinion on that, but how does one make those decisions? What's the criteria to look at?
Yeah, I mean, the first thing I'll say is that I think school is essential for kids. So, I think that, we need to treat school like we do hospitals. They need to be open. Obviously, there are safety precautions that need to be taken. And so I would be hesitant to send my kid into school if I thought that the school wasn't able to adhere to the rules that are required to limit transmission of coronavirus within the walls of the school. So if your school is not able to space children out by 6 feet in the classrooms and de-densify classrooms, if the school, then I would be very worried. If the school is loose about mask wearing, that would be a deal breaker for me. If they're not strict about masks, that would be a deal breaker, because we know masks are essential.
So assuming that they're eating lunch in a cafeteria, then
yeah. So remember that to mitigate risk requires layers, right? So if you're going to undo one of the layers, like eating and taking your mask down, then you just need to be further than 6 feet and have good ventilation and not that many kids in that one room. So I would be hesitant to say to my kid, if they were lax about masks, if they didn't have a good ventilation system that could circulate the air and take away those small aerosolized particles out of circulation, and if they weren't able to de-densify the classroom or separate the kids by 6 feet, or if they didn't have a good community community contract. We all know that people in this country are very individualistic and everyone wants to do what they want to do. And even though they say don't travel over Christmas, some people will. And for reasons that you and I might think are frivolous and they think are really important. But nonetheless, I think it's important for communities to have a contract saying that we are all in this together. So if my school, was overtly flouting the rules or just logistically unable to have those precautions in place, I would be hesitant. But most schools in this country, and this is a very broad generalization, but are doing a decent job. And if you have kids masked, teachers masked, and face shield on teachers who are at higher risk, and there's good ventilation and they're distanced, the benefits to kids in going to school are enormous, and the detriments are huge as well. So for not going to school.
Totally understood. So we only have about 10 minutes left. So I have a bunch of straight out medical questions.
Sure.
Okay. Why do some long haulers experience relapses and remissions? What contributes to the severity and duration of a given relapse, and what can we do to prevent and or mitigate them?
So it's a great question, and it reminds me of my patients, as I said earlier, who have chronic fatigue syndrome, which is often brought on by post-viral phenomenon, like patients who have MANA or patients who have CMV, cytomegalovirus, who will have symptoms of chronic fatigue for months and sometimes years after the initial virus. It's really supportive care, prioritizing sleep, making sure you get 7, 8, and sometimes 9 hours of sleep, and not apologizing for that. That's what your body is asking for. Really, really aggressive hydration. Advil, Aleve, and other anti-inflammatories can be very, very helpful to reduce inflammation and help with pain. And then, getting outside in nature, there's such a mind-body connection. This is not to say that people who have long tail symptoms are making these things up, or they're only in their mind. But I'm still saying that even though they are very real and organic, being in nature, being outside, connecting with other people, those are the things we can offer right now until we have a better understanding of the mechanism by which people have such waxing and waning and long-term symptoms.
That's really great advice. So, it seems that whereas men are more likely to end up hospitalized, ventilated, dying, it seems that more women are suffering from long-term COVID. We don't know exactly what the numbers are yet, but it does seem to be trending much more towards women. Do you know why? Do you know why women are more susceptible? Is it a biological thing? Is it that women are more likely to experience autoimmune issues? And vis-a-vis, and as the follow-up to that question, can the virus impact hormone levels, reproductive health? And we know that it can affect men's sexual function in terms of erectile dysfunction. Can it also affect women's sexual function?
So I wish I knew the answer to why women are more prone to the long hauler effects of COVID-19. I wish I knew why women were more affected by autoimmune disease. It may be that, this is just part of it. I know this is part of it, but that women are more likely to ask for help for these symptoms, and men tend to, unfortunately, muscle through these things and not bring them to the attention of medical providers. But there is something biological about it that's gender-based. It may be hormonal. We just don't know. I wish I did, and I would be hypothesizing and theorizing by putting things out there, but we just don't know. The answer to your question of can COVID-19 affect women's reproductive health is unknown. We don't know the answer to that about fertility, but it stands to reason that it can affect sexual function. I mean, sexual function is a biological, chemical, physiological, and emotional process. So it makes sense that it would affect sexual function in some way. Whether or not it causes infertility, we don't know. I got a question actually yesterday from a patient of mine about the vaccine and whether she's trying to get pregnant next year or the year after, and would the vaccine affect her fertility? And what I said to her is that, we don't know the answer to that per se, but it stands to reason based on what we know about coronavirus, that coronavirus is much more likely to affect your fertility than the vaccine is. So I would recommend that vaccine for anybody who can get it.
I will 100% be taking the vaccine the moment it is released. So I have already made that pledge and I repeat it often. So I recommend that everybody get that vaccine the second it is your turn in line.
And I'd love to talk about the vaccine for just a quick second.
Yeah, please.
It's important that people know that there are two common side effects that we need to tell people about, because we have to be forthright and disclose these pieces of information so people don't worry or think that or feel distrustful of the vaccine itself. The two side effects are, number one, pain, redness, and soreness of your arm at the injection site. And that is normal and that is common and expected. The other is transient body aches, fever, and fatigue immediately afterwards. So for a day or so, people might want to take a day off work the next day, or you might not have anything, but it's important to note that that is not COVID-19. There's no way, it's impossible to get COVID-19 from the vaccine, just like it's impossible to get the flu from the flu shot. But you can get the very, very normal side effects from the vaccine that indicate your body is appropriately responding to the vaccine and is mounting the antibody response you need when COVID itself comes your way, and you will be 95% protected against COVID-19 if you get the vaccine. So I do recommend it.
So one of the most frequent questions that we get is, I had COVID. I am still experiencing the long tail sequela of long-term COVID. I am really suffering. Am I in a position to go take this vaccine, or will it, spark a, re-inflammation or I don't want to say reactivation, but a resurfacing of symptoms, or will it cause any ill effect if I had such a terrible reaction? I'm using the royal we here, to the actual virus. And has it been tested on, or I don't know if you know the answer.
So take the Pfizer and the BioNTech partnership vaccine that's supposed to be approved later today or tomorrow. I think it was 196 or 92 patients developed COVID-19. And I don't think people were included in the trial who had coronavirus. So I don't think we know the answer to that question. But again, it stands to reason that you would, even if you have long tail COVID symptoms, that the mRNA vaccine would not elicit a long, those symptoms again. But again, it's still under study. And remember that if you had COVID-19, we know from studies that you're immune and you have antibodies and an immune response that's durable for at least 3 to 4 months after the infection. So you also might want to wait and see and get your vaccine after other people who need it more than perhaps you do, who haven't had the disease, get it first, and then wait for more study to understand the side effects. But so far, the safety profile looks very, very good.
Do you think that different vaccines will be better for different populations, or is it just wherever you come up in line?
I think we don't know yet. I mean, that's one of the problems with the AstraZeneca vaccine is it may be less effective in older people, but we just don't know. The data on that vaccine is a little bit tricky, but also it looks very, very promising. They've just lost public trust, unfortunately, or tarnished it a little bit And I'm hoping that it will come out and be just as effective as the Pfizer and Moderna vaccines. But for now, I would say that when your turn in line comes up, take it.
Absolutely. We're pretty much out of time. I'm going to end with one last question. You gave some recommendations on supplements to, boost your immunity if you haven't had COVID. Do you have other suggestions on diet and supplements and other recommendations for people who are struggling with long-term COVID?
Yeah, so that's a great question. In general, and I talk about this every day with patients, people feel best and their immune system works best and inflammation tends to be lower when people are consuming less sugar, and when they are eating 3 solid meals a day. They don't need to be Pinterest perfect, but if you are getting whole grains, greens, protein, fiber with breakfast, lunch, and dinner, and minimizing processed foods, minimizing sugar and refined starches, your energy in general is going to be better. And no doubt your energy, if you're suffering from COVID-19, will be better as well. So those are my broad brushstrokes. A lot of people are suffering with alcohol use and overuse. Most people who are drinking too much are not patients who are per se alcoholic, but just it's a habit and a routine that becomes sort of a slippery slope when there are very few ways to find joy and relaxation after a long day of work. So, you also want to be careful about alcohol because alcohol can cause inflammation. It can disrupt sleep. It can exacerbate hot flashes in menopausal women. It can also exacerbate the fevers and chills and the symptoms of COVID-19. So as much as we're tempted, whether you have COVID or not, or the tail of the symptoms to drink more in the pandemic to get us through the winter, just be mindful about it and also have a conversation with your doctor about it. I'm talking about it with patients every day, and there are ways to moderate it and be smart about it, and still have fun every now and then.
How does one moderate it? Out of curiosity.
That's a great question on a Friday night. No, it depends
asking
on who
for a friend. I'm asking for a friend.
Asking for a friend. It depends on who you are, but the relationship with alcohol is so different for every person. But one kind of rule of thumb for people is try to limit it to weekends only, and make your weekend start on a Thursday. So do Thursday, Friday, Saturday, keep it to 1 or 2 glasses, and try not to have anything 2 hours before you go to bed. But again, if you have an addiction to alcohol and you're struggling, 1 glass is too much. So it really depends on who you are. But just know that it does, interfere with our sleep. It interferes with our blood pressure. It jacks up our blood sugar, tends to rev the stress hormones. And so, while alcohol tastes great in the moment, it does have a price tag. So, maybe not the most fun way to end on a Friday afternoon, but I'll leave it there.
Okay. Well, thank you so much, Dr. McBride. I know how busy you are. And so for taking a full hour out of your extraordinary schedule to be with us today is a huge honor. And thank you. Do you have any final words of wisdom that you want to share?
I'll just say this. First of all, thank you for having me. It's really an honor to be with you guys. And I'm really impressed, as I said earlier, at what you put together, Diana, and all the hard work that the Survivor Corps group is doing. I'll just say this. This will be over. This will end. Hope is alive. Help is on the way. We need to bear down and buckle down and get through the next 3 to 4 months by being really, really careful with all of the risk mitigation precautions and just be kind to ourselves and our neighbors. There's so much we have control over, even though it feels like we don't. Getting outside, socializing with friends, prioritizing your sleep, moderating alcohol, getting 3 good meals a day, checking in with a therapist, trying the meditation app, there's taking those vitamins. There's a lot we can control, and we will get to the other side. Hope is alive, and hope is good for our health.
That is great because we all need hope right now. But just with a little bit of measure, I will add that, the vaccine is a godsend. It is not a panacea. So please continue to wear your masks, continue to follow all the rules, get your vaccine when it's your turn, and then keep on wearing a mask and keep on following the rules until everybody has gotten the vaccine. And then we will be on the other side. So We're close, but we're not there.
That's right.
So that's cute. I just want to make sure that everyone has a measured level of hope. So thank you, Dr. McBride, and thank you all Survivor Corps superheroes. Keep on doing what you're doing.
Yeah.
You're doing great.
One day at a time.
Yeah. Bye-bye.
Take care. Bye, Diana.
Bye.